I'm Ebony Carruthers. I'm with the APTA Section on Women's Health Student Special Interest Group, and today I'm doing an interview with Colleen Schomburg from UPMC, Centers of Rehab Services. I'm going to ask her a few questions about their women's health residency. So would you like to introduce the program a little bit, tell us a little bit about it in your own words?
Sure. Again, I'm Colleen Schomburg, and I'm the director of the Women's Health Residency for UPMC, or University of Pittsburgh's Medical Center Systems. And we have five actually residency programs within our system. I like to mention that because our residents do tend to work with each other. Our program is 16 months in length. We start in August, mid-August, and we go to mid-December. We tend to take 1 to 2 residents, and we have probably our biggest asset is the amount of mentors we have. We have a group of 25 women's health therapists, and and about 10 of those act as part of mentors as part of our residency program. Do you have other specific questions about our program?
Yes. So when are the applications due?
Good question. So our applications are due January 31st every year, and applications are taken through the RFPT CAST program online, and it opens usually about the beginning of October every year.
Okay, and how long has your program been around?
Our program, let's see, we were just reaccredited last year, so I think that means that our program has been around, sorry, I'm trying to do the math, 7 or 8 years. I think we had to get reaccredited every 7 years. So yeah, I have been in the role since 2012 as the director, but I was one of the founding mentors of the program.
Okay, and how many residents per year?
So we always have at least 1, but we have taken 2.
You have taken 2. Okay. Mm-hmm. And how many have passed the WCS exam?
All have passed a WCS exam.
Okay. And then, so can you tell us about the acceptance and then qualification? So what does the ideal applicant look like special experience or new grads, prerequisites?
Sure. So our main requirements are really just have been a graduate of a accredited PT program, but most of our applicants are in the process of graduating when they're applying. So a lot of them aren't passing their board sometimes till July before they start with us. But we have taken sort of non-traditional students or applicants that maybe have been out of school a few years as well. And we do not require any sort of women's health experience, but it's always helpful. I always do advise if applicants have the chance to take a level 1 pelvic floor course, it can be really helpful. And then, or if they have the opportunity to do some shadowing or an internship or student affiliation within women's health, I think obviously that can be helpful as well. The application process, there's 2 essay questions that just ask about your interest in women's health, as well as any experience that may qualify you to be a good resident, and 3 recommendations, 1 from a faculty member of your PT program, 1 from a physical therapist, ideally a women's health therapist if possible, and the 3rd one is just no requirement, just 1 other reference. And then trying to think what else is on the application. What's that?
Interview?
So yeah, we do require an interview, and our interviews are always run basically it's the 2nd Friday in March. And it is a joint interview with some of our other residency programs. So it's unfortunately not a negotiable day because it's run. We bring together not only all of our a lot of our mentors, but also some of our senior management team within our company to really meet with the residents, because we do invest a lot in our residents and we take a lot of time to make sure we get the right fit for our residents.
And do you have any maybe tips, or what are you looking for for that interview specifically to help you choose the best?
I mean, honestly, it's not always the most experienced applicant. A lot of times it is, the person who we think meets our, is looking for a program similar to ours. And who, is looking for we have our desires kind of match up. So, someone that understands our program, understands that it's a multifaceted program that focuses on every aspect of women's health, and really has that desire to learn all of those things. I'd say that's maybe something that sets our program apart a little bit, is that we do offer experience in just about any possible specialty within women's health. And we get such a variety of patients that, sometimes we get applicants that really want to focus on pelvic health. And although that's a huge part of what we do, it's also a percentage of what we do. We see a lot of other women's health patients as well. So we're really looking for someone that's really looking for a program like ours, and is ready to commit the time, and maybe sometimes even, move to Pittsburgh and willing to spend time here and really commit themselves to our program. And so I think that's really what we're looking for on interview is someone to kind of show us that they're dedicated and they're really looking for a program like us to really further their education.
Okay. And when do you notify your residents of their status?
So pretty much with the app for the first round of decision making is really just the interview process. So we really try to, by the beginning of February, before CSM, have interviews offered. And it depends on the application pool. Sometimes, everyone who applies gets an interview, and sometimes we do get a plethora of applicants, and we really have to, pick and choose who to bring in for an interview. But we try to make those notifications, we try to get them out by the beginning of February so people can make those travel arrangements as necessary from mid-March. And then the second round, obviously, is after interviews, deciding who is going to be offered a position, and it's usually within 2 weeks of the interview process. So about mid-March to the end of March, we usually have made those offers, and then if people don't get accepted, it might be another week or two, because obviously we're looking for those commitments before we're going to decline anybody.
Okay. And so you said that you work with other residencies. So does that mean that the residents get to work with other?
Yes, and I do think that's a benefit for our program. So a lot of our orthopedic education is done in conjunction with our orthopedic and sports residencies. So our residents do a hip module and a shoulder module and a running module, and those are all done in conjunction with orthopedic and sports. They also have optional modules that they can do. So the orthopedic and sports residents have some required ones that our residents are invited to attend as well. They also do a evidence-based manual therapy 5-course series that's also done in conjunction with the orthopedic and sports residents. So and we also have geriatric and neuro residents as well. So it's we do Friday afternoon leadership series where they're all together, about once a month or once every other month, where we bring in speakers. So it's nice because it does create almost like a class of students versus just like you're on your own going through residency. So even if you would be only one resident in the women's health program, like this year we only have one, you still have a whole team of other residents that you're sort of at least going through the process with. For example, they all stay usually together at CSM and things like that, and tend to become friends throughout the process.
And what settings are they exposed to during that?
Good question. So primarily outpatient. All of the exposure and clinical time is 100% within the description of specialty practice. But we do have our residents spend about a month, 8 hours a week for a month in our women's hospital. It's called UPMC McGee Women's Hospital. So they spend about, right in the beginning of their residency, they spend 8 hours a week for usually the month of September, getting exposed to patients right out of breast cancer surgery and gynecological surgeries, as well as patients that are postpartum, that are requiring physical therapy or maybe even antepartum and on bed rest at the hospital. So they get exposed to that. But I would say the biggest setting that they're in is the outpatients. But within our outpatient setting, we see, pregnant patients, postpartum patients, chronic pelvic pain patients, obviously incontinent patients, both male and female patients with those pelvic floor diagnoses. We see a good amount of both upper and lower extremity lymphedema, including sometimes, wounds and skin changes. We also sometimes see head and neck cancer patients. What am I forgetting? So, a broad, female athletes definitely return to sport postpartum, sometimes just chronic back pain, tailbone pain, SI dysfunction. So it's a really broad spectrum of patients. And then we have required specialty practice observations where the residents go and observe surgeries with gynecologists and urogynecologists, GI specialists, colorectal specialists, plastic surgeons, breast cancer surgeons, and then they also observe in the clinic with those physicians as well. So they get exposure to those settings too.
Okay. And about your curriculum, how many one-on-one mentoring hours do the residents get per week? How are they structured?
Good question. So, so with mentorship, the way it works is, well, let me just backtrack a little bit and piggyback to this question. What happens in the beginning of residency? So right now, my new resident is doing is spending a lot of time just getting exposed to women's health. So although she had a clinical in women's health, most of our residents come in with little to no pelvic floor experience or lymphedema experience. Although they, can, pretty much pick up and learn to treat maybe a pregnant patient or some of the more orthopedic diagnoses. So we spend a lot of time with the resident doing both didactic and lab work in pelvic floor and lymphedema, and then having them first shadow us and then co-treat with us and then start to help us really take over some of our caseload, similar to maybe what a student would do in the beginning. And then what happens usually it takes till about, I'd say 8 weeks in, maybe 6 to 8 weeks in, that the resident starts to develop a full caseload on their own. And even at that time, though, they're getting a full hour, maybe more, with their patients. And that's when we'll start scheduling mentors. And our mentors schedule for about 3 hours a week. So on the resident's caseload, it's basically happens in the beginning of the month. We sign up for about a 3-month period, so the resident knows when they're going to have mentorship, and they can schedule appropriate patients, or they might reach out to a mentor to see if they can come at a certain time when they know they need help on a certain patient. But it's generally 3 hours a week throughout residency. And then there's also opportunities for reverse mentoring, where the resident can go and spend time with the mentor at watching and helping them treat their caseload. So we are required to provide 100 hours of mentorship for the resident to have on their patients. And then usually we do go above and beyond that. And then usually at least 50 hours of that reverse mentoring as well. So yeah, it breaks down to about 3 hours of that scheduled mentoring a week.
Okay. And then you talked about some of the optional modules and then the manual therapy. Are there certifications that are sponsored through the program?
Yeah, so we do a big part of our program is definitely the lymphedema certification course. It always comes to Pittsburgh in January, and we actually like that timing. We've played with that timing throughout the last 5 to 10 years that we've been around, and we've offered it at the beginning and found that it's almost overwhelming for the residents to learn both lymphedema and pelvic floor at the same time. So what we do is tend to give them kind of an introduction and exposure to lymphedema, and then send them to the certification course in January. And they seem to process that information a lot better after they get that exposure anyway, and they're not as overwhelmed with getting everything at once. So that's a big part of it, is that a week-long certification course for lymphedema. And then we have a group of modules. We have a pelvic floor module that basically starts the first week of residency, and it's both didactic and lab. And the residents work through voiced over PowerPoints that provides all the didactic information, and then they meet with Susan George, our director of women's health, who teaches the pelvic floor module, and they go through, I think it's 11 different labs they complete, and it's usually within the first week or two to get through all of the pelvic floor. And then there's once they finish the introductory pelvic floor, there is an advanced pelvic floor that they're required to work through within the first few months. We also have additional self-study modules that they work through throughout the curriculum, or I'm sorry, throughout the residency program. Those are, there's a lymphedema module that they do also within the first few months, and an antepartum module that they do within the first few months. And then later on, they do a GI module that is lab as well as didactic, and in the past it's been taught as a live course as well. We've done it both ways, but if we have enough participants, we'll do a live GI course, and that's taught by Susan George as well. And then we have a female athlete triad module, an oncology module, a biofeedback module, and a bone health module that focuses on osteoporosis. And all of those, like I said, they're self-study, but they're voiced over PowerPoints, and they have, assessment at the end, assessment of learning, and they're due at varying time points throughout the residency program.
Okay. And you said that you had the sports, ortho, the men's, and different areas incorporated. Did you mention pediatric at all?
That's a good question. I would say that would be a little bit of our weakness. I would say I see 1 to 2 pediatric patients a year. I would say that's pretty typical for most of our pelvic floor therapists. And again, sometimes we see pediatric lymphedema too. But Children's Hospital of Pittsburgh, which is under our system, has their urology program does have nurses that do biofeedback, so we don't tend to get as many pediatric referrals as maybe some other programs do. Okay.
And what about teaching opportunities or research?
Yes, great. So our residents all are teaching assistants in the musculoskeletal courses at Pitt. That's somewhere between about a 10-hour commitment a week that they are going into Pitt and participating as lab assistants in their program, and that's throughout the school year. And then they're off during the summer, and that's when they're usually spending that extra time doing their specialty observations with the physicians. They also, as far as research, they have some opportunities within the system, but the thing that they do on their own is very early on in the residency, they choose a patient to write their case study for the WCS on. And we're really lucky to have Diane Barilla France, who was a former editor of the Journal of Women's Health. She's on faculty with us. So she is very helpful to the residents and developing that case reflection. And what they do even before they kind of get to the stage of the writing the case reflection is they present that patient in grand rounds at Pitt. So it's a nice progression where they're first preparing a PowerPoint presentation and reviewing the literature to present to the students and faculty at Pitt. And then that usually happens around April or May. I'm sorry, actually March or April, and then they're usually I have already started at that point on their case reflection, and they're working with Diane to turn that into the paper that'll be due with the WCS, and that's usually due in July. So they have that kind of, and then we encourage them to turn it into a case study as well. And we have had one of our residents that had their case study recently published, actually in the April PT journal, PTJ. So yeah, so and that was based on the patient she wrote about with us, that she wrote her case reflection on. And then the other requirement as far as research goes is an outcomes, either paper or PowerPoint, but basically what the residents do is collect and monitor their outcomes throughout residency. And then at the end of November before graduation, they either write up a paper or put together a PowerPoint to present to our women's health team to just review how they did and review their outcomes with their patients and kind of reflect on that as well.
Okay, and then can you tell us a little bit about the area of the residency, like cost of living?
That's great. Yeah, sure. So luckily, Pittsburgh is pretty low cost of living. I don't have a lot of specific numbers, but I'd say comparative to most larger cities, it's relatively cheap to live here. So that makes it reasonable. We do have a tuition. It's currently $9,600. The way it works, though, is that it's removed from the resident's paycheck before they even get it. So I think their base salary is around $43,000 a year. So they net. Let me see. So they're netting over 30, and pretty much people do pretty well with that. It seems, I know, compared to new grads that are looking at taking a full-time PT position, it's definitely not nearly as much as you might make, but residents do just fine in Pittsburgh considering the cost of living.
Are there, for housing options, do you guys offer them or maybe have suggestions? Or
we definitely have suggestions, and because we work for a large health system, there are HR representatives that are really that's all they do is help employees moving to the area find housing.
Okay, and then so what is the likelihood of being hired on afterwards? Do you prefer that residents stay and work?
We love when we have the opportunity to hire on residents. It definitely, I would say for the first time in a long time, we haven't had constant open positions on our women's health team. I'd say it's been about a year since we've had a constant open position, but I know we have one opening up soon. So we have since then hired 2 people. So although it's not, there's not always a position open, it's not uncommon for there to be a position open, and we've grown. When I started with the program 15 years ago, there were only 5 of us, and now we're talking over 25 therapists. So it's grown substantially, and we continue to grow. So, although I have to say there's only 1 resident that did stay on with us, and but that's also she was our only resident that was from the area. So actually just now our new resident is from the area, and I know she hopes to stay on with us. But most of our residents in the past have come from out of state and either moved back home or moved back to family or a spouse. And so we haven't been lucky enough to keep as many of our residents here. But like I said, we do have one, and she's a wealth of a resource because she's a mentor now on the team and very active within the faculty.
Okay, well, those are all the questions I have. Thank you so much for answering all of them.
You're welcome. It was so nice to meet you, Ebony.
Yes, it was great talking to you. Thank you.
Okay, you're welcome. Bye.
Okay, and then